On September 9th, New York State declared a state of emergency following samples of wastewater testing positive for polio virus. Unlike some other diseases, polio can spread without you coming into contact with another person.
You could shed the virus still in your stool,
making it easy for the virus to spread through drinking water. And according to the CDC, 70% of people will carry the virus without symptoms, and 20% will write it off as a flu-like illness.
The main polio symptoms people can experience are like any other virus. I feel tired. I have a little bit of headache. I'm a little bit drowsy. I feel achy all over. And it usually is short-lived. And that's if you were infected with polio.
According to the New York State Department of Health, those who finish their vaccination series shouldn't have to worry about the paralytic disease. The concern is for people who weren't immunized.
Paralysis or problems, and that's in less than 1% of the cases.
Studies show up to 10% of those people will die when their breathing muscles become immobilized. And Dr. Nistico says skipping out on routine vaccinations from birth creates a risk years down the line.
And when people stop vaccinating, it's like preparing for the storm. If you're not going to prepare, even though you may not get a storm for a year or two, but when you're prepared, you'll be able to face the storm.
Health experts recommend taking preventative measures during childhood, and if you get sick, the options are limited.
There is no treatment per se that is definitive if you have a paralytic or paralytic type of polio, where you have that very rare type that has progressed to cause you muscle weakness and having loss of some sensation.
Doctors say the risk of illness from polio isn't the same as a new disease, where options are limited to keep your child safe.
This is a simple vaccine that people can actually get, and it's not in short supply. It's something that we routinely give.
The CDC credits mass vaccination campaigns to the elimination of the illness. With a resurgence,
that's really where we just need to focus is our efforts on vaccination so that we can go back to not really having to worry about polio, because it is something we know we have treated and eradicated.
For Arnot Health, I'm Lexi Cutmore.